An IVF cycle consists of two clear elements. The first is the creation of embryos in the IVF lab. The second is transferring an embryo to the womb to create a pregnancy. In the early days of IVF practice, these two elements usually occurred in the same cycle. For some patients, this approach remains reasonable, especially where a low ovarian reserve and a lower number of eggs collected is predicted. We now believe for many patients, better IVF outcomes can be achieved by integrating a freeze-first philosophy. In a natural menstrual cycle, one dominant ovarian follicle is selected, creating the ideal amount of hormone to prepare the womb for pregnancy. From that follicle, one egg is released. In IVF, we stimulate the ovaries using hormone medicine so that many follicles grow and multiple eggs can ripen for collection. Not every egg has equal potential. With increased egg numbers comes an increased chance of creating viable embryos. High hormone levels in IVF cause the womb lining, the endometrium, to grow in an abnormal fashion, associated with a reduced chance of successful embryo implantation. When we replace your highest quality embryo in a stimulated cycle, we worry in many cases that it may not be given its best chance to succeed. In modern IVF practice, over 95% of embryos frozen with vitrification technology survive very well. An argument for fresh embryo transfer is the potential loss of an embryo to the freezing process. While this does occur occasionally, it is a relatively rare complication. Embryo freezing affords us the benefit of transferring an embryo in a separate, dedicated month, ensuring an optimal implantation environment. Freeze-first IVF minimises risks of ovarian hyperstimulation syndrome and creates the opportunity for embryo banking. Creating an embryo bank is a very strong strategy for long-term family planning in IVF. You may choose to bank 2 to 3 frozen embryos per future child desired before progressing with an embryo transfer. Achieving this goal may require more than one stimulated IVF cycle. A freeze-first approach can strategically reduce the number of stimulated IVF cycles needed over a woman's lifetime. When a woman first attempts IVF, compared to a few years in her future, her personal IVF prognosis is considerably better. Choosing to bank embryos at the start of treatment can improve her chance of having 2 or more children.